Good evening, everyone. My name is Dr. Taran Kulkarni, and I am a pulmonologist at Hospital Thane. So, a few words about UMANG before we begin. So, UMANG project is a movement that is for the doctors and by the doctors. It's a bi-monthly meeting that we have, which involves specialists, which involves medicos from all the Medicare facilities. We talk about a lot of issues from the early professional beginning to retirement. So this is a very powerful movement that has been started. I would ask everyone to go to the YouTube channel and like the page, because all of the previous meetings and this meeting will also be uploaded on YouTube. So, speaking about today's topic, it's about residency woes. So, residency is an extremely important point of every professional career. It is the point where you learn the thing that you're going to be practicing for the rest of the lives. But as all of our experiences taken together, there are a lot of issues related to residency, which actually, if are not addressed at the right time, could have disastrous consequences. So, to begin the meeting, I would like to invite my co moderator, Dr. Swapnali Kadam. Dr. Swapnali Kadam, ma'am, is an additional professor and HOD in the Department of Physiology at Rajiv Gandhi Medical College. She is the additional Vice Dean of Academics, and she has done a lot of work regarding resident related problems and has worked with multiple residents and juniors to overcome their issues related to residency. So, Dr. Sapnali, I invite you, and we should take this forward.
Yeah, thank you so much, sir. So we are here today with a very sensitive topic, and for this we have got panelist as Dr. Santosh Salagre, sir, who is a MD Medicine with so many degrees and with so many fellowships also. Sir is Dean NESCO Jumbo COVID Hospital Phase 2. Sir is Professor, Unit Head, and in charge of the hypertension services at GS Medical College and KM Hospital. He has conducted more than 275 workshops on communication skill, professionalism, and bioethics at national level. He has also written the chapter on the communication skill into API textbook of medicine. He's trainer for communication skill at MUHS at Maharashtra University. He's an ex-unit head of GSMC MUHS UNESCO Bioethics Unit and currently member of GSMC MUHS International Chair Bioethics Unit. Have undertaken many innovative projects of undergraduates and postgraduates, mainly of the medical education. I welcome Sir because Sir has been my mentor also for many years, and I'm really happy to have you here, Sir.
Thank you, sir.
Dr. Mamta Shetty, I know her on my personal level, so I am really pleased to invite you, Madam, here. Madam has done her PhD from Tata Institute of Social Sciences. She was assistant professor in TEAS from 2013 to 19. And she has a teaching experience mainly in the master's and MPhil program of clinical counseling and psychology. No doubt, Madam has been psychologist and psychotherapist with a private practice since last 23 years. Madam is a consultant psychologist at Fortis, Mumbai and Jupiter Thane. She's also presently visiting lecturer at Xavier's College and teaches for master's and postgraduate diploma courses in applied psychology. I welcome you, Madam, for the session.
Thank you.
We have two residents here, and one of the residents is my own student. I'm really happy to share her CV. Dr. Ashwini Ghaisa, she's undergraduate student of mine from Rajiv Gandhi Medical College, and now she has done her MS OBGY, and she's presently doing her fellowship in fetal medicine at KM Pune. She has received Best Poster Award at Star Endogene Conclave in 2019. She has also got a best paper presentation award at Clinical Legal National Conference in 2019. And I'm really happy to have you here, Ashwini, with me. Being a teacher, it's my pleasure to be with you on the same platform. And
Thank you, ma'am.
I welcome Dr. Bittu Kaur Sodhi. He is a MBBS DNB General Medicine Clinical Associated at Jupiter Hospital, and he has a lot many interesting hobbies, and that is what is very. I think that makes a lot of importance in our today's scenario when he has his hobbies which are there, which he still continuing. I am happy to have you, and I will like you all to give you a lot many inputs into it for today's session.
Thank you so much, ma'am.
Yeah, I'm so sorry. I wasn't. I'm so sorry.
That's all right. That's all right. I get that a lot.
Yeah. Uh, uh, so for the today's session, what is the? I think today's one news has shaken me, and that is a one more additional stuff which is there in this present issue of which we are uh, though it's probably looks like only the iceberg phenomena, and we are able to see only the tip of it and not the actual whole of the iceberg of it. But today's news was there into the news was the Safdarjung Hospital horror, and that is where the student has written, I was abused and made to work for 110 hours of continuous duty till cellulitis developed in my legs, in my feet, and yet were not allowed to sleep and bullied on daily basis by my seniors. She has an all India rank of 1300, female surgery resident who attempted suicide and still depressed. This note was very disheartening, and as all of us know, that this has been the bullying and the ragging by the senior students. When I was talking to Taran regarding this session, and this was I always feel is more like a sas bahu, jo maine bhugta wo aap bhi bhugto. I know that even when I was a resident at one point, not in physiology, I was doing medicine before this. And when I was doing medicine, even I have attested to work for 48 hours or more than that. But that should not be the next scenario, which should be a major thing which we should keep in mind. Other than that, one more thing which I really want to comment before we go for the actual session is nearly from the 80,000 medical graduates coming to India every time from approximately 529 colleges, which are day by day increasing. Obviously, we are looking forward for many more graduates, and that is going to be a really lot many burden for the teachers as well as for the students to handle the academic stress as well as the other balances of the life. The National Crime Records of the Bureau occupation wise gives a breakup, but they actually do not have any separate information for the medical professionals. But this, based on the news report, there has been studies, and that has given approximately in last 10 years the 358 deaths. Out of that, the medical students, the alarming points are medical students 125, undergraduate, residents 105, and physicians 128. This is, as I said, that it is only we are considering the suicide which is reported and not the other things, which is really a very shocking thing. And other than that, the deliberate harm and parasuicides are underreported because of the act which is there for the suicide. So looking at it, it's a huge task for us to look at the mental health of the residents and looking and what I will like to say is out of this also, the maximum deaths among the residents also were majorly into the anesthesia department, which is more than 20% of total resident deaths. And that is one thing which probably is where the anesthetic easy approaches of the other drugs which are easy for the suicide. So that can be the one of the reasons, but there are many reasons which are there. And overall, at the worldwide also, there are a lot many total deaths which you can see. The major challenges, I think, Dr. Bittu, Dr. Ashwini, and Dr. Salakde sir will give us the little more introspect. But every one of us, being a medical professional, we should look into the matter why so many suicides among the students, among the residents, and that we really need to take forward for seeing, because we being a well-educated and highly educated people are not able to manage the stress, then it is really, because it's a known that in a total suicides, it's a major chunk of the suicides is from the illiterates and from below six standard education background. But we being knowing everything and all the possible things, somewhere the support system is really failing. And as a teachers, as well as our colleagues, and as a community as a whole, we should look into the matter. I think this, I keep it a open session now for everyone to discuss. The first thing where, as I said, that the causes can be taken care by Dr. Bittu and Dr. Ashwini, and sir can give a comment over it. Please, hand over. Dr. Ashwini, Dr. Bittu?
Yes, ma'am.
Yeah, you can just say.
Hello.
Yes,
Hello.
yes, Dr. Ashwin, we can hear you. Yes.
Okay. Ma'am, what I feel is there are two major points in this. First of all, getting admission into medical field, and secondly, coming after into medical field, how the behavior goes. I mean, first of all, getting into medical field, the decision is always shaky. Like this, like many a times we see that the people take in a flow that अच्छे marks मिल गए तो ले लो, medical में मिल रहा है तो ले लो. So that is sort of a pressure by choice. Like only few of them come to medicine. So when they come, they suddenly get shaken because the pattern of medical field is only different, because it's a professional course. And once coming into medical field, like if residency per se, I feel that the environment is totally different. They're supposed to stay there, and many of them, like few of them, are localites. So before that, they have never stayed in the hostel, so they are not used to it. So I feel getting used to that environment and the food out there, the place out there, the people out there, that is really difficult in the beginning. And when we go and join the work, suddenly like everybody is ready, like juniors have come, so that attitude creates some sort of a fear in, I think, the minds of new
Well said.
residents.
Well said. Yeah.
So that should be gone. But the thing is, there are two things again. There are clinical fields and there are non-clinical fields. In people from non-clinical fields can get adjusted well, because the course is only different. But in from the people from clinical field, they are supposed to slog. I mean, there is no as such, you can't just let go of the things. I mean, because it is emergency and you can't say that we can't do this, we can't do that. So slowly, steadily, but I feel you need to understand, you need to work, and there only the problem happens, because many things are going around. At many a times it's like, most of the times it's a hostel problem. The different sort of introduction is going on at the hostel, so that creates more pressure, I feel.
Okay. So, Doctor, thank you, Dr. Ashwin. That was really pertinent. So, quickly to Dr. Bittu. Dr. Bittu, you did your residency in a private hospital.
Yes,
The
sir.
problems of private hospital, I assume, would be different to what Dr. Ashwini just spoke about. So, can you just elaborate on that?
Yes, sir. So in private hospital, what happens is, if you look at the scenario, the number of seats per year, the number of candidates that you get per year is very less when you go on to compare it to a government setup. So in that situation, what happens is sometimes you are the sole resident in the department. Not always necessary that you'll be alone, but sometimes you are the only resident. And sometimes if the institute has just got that accreditation, maybe you're the first batch, so you do not even have a senior you can look up to, a senior who can guide you. So obviously your teachers are going to be there, but then there are certain situations where your seniors can guide you better with the thesis work, with a little bit of tricks and tips here and there, with the sort of jugaad thing, and how to handle emergencies at night. So before calling my consultant up at 2 a.m. in the night, I'm definitely going to be scared. So if I have an immediate senior I can look up to and just contact them, and they can guide me that how I'm supposed to handle this emergency. And then because the number of students are very limited, so at the end of the day, if I want to, if I had a bad tiring day and I just want to decompress, go out, I might not have company to go out. because your co might be on call, or the other batchmates, they are on call. So the social interaction gets very limited as compared to a government setup. And the other thing, in a private institute, in a private setup, is how you communicate with the patients. So unfortunately, in an MBBS curriculum, you do not have a specific set of instructions which are given to you, that how you're supposed to communicate to patients, how are you supposed to break bad news, how are you supposed to calm down panicky patients. Sometimes you also come across arrogant patients in a private setup. So they have this mentality that I have paid for these services, so I'm supposed to be treated in this manner. There's nothing wrong if you think from their point of view that they are expecting a certain sort of treatment. So at that point of time, how do you maintain your calm, your composure, and do not react immediately and deal with it? These are things that you're not really taught. So these are something that you have to navigate on your own. You have to pick up as you work through this. And then somehow in the medical fraternity, there still exists a bit of MD-MS versus DNB. So if you come across people who are doing MD-MS, you often get those indirect taunts and subtle jabs that हाँ ये तो DNB कर रहा है, DNB तो easily मिल जाता है. So when you are in that vulnerable phase where you're dealing with all of those challenges, where you're not just a student anymore, you are responsible for the patient, you're actively involved, you are handling a lot of things. As Dr. Ashwini mentioned, that you mostly stay in a hostel, you are maybe moving into a different city, a different state altogether. So there are many things that you have to adapt to at the same time. So in
Well
addition to
said.
this, when you're getting such taunts and such jabs, they kind of affect you a lot at that particular point of time.
So two completely different perspectives. Thank you so much, Dr. Ashwini and Bittu. Salagre sir, a quick comment, sir, about this.
Yes, I was listening to the previous generation thought process, and it is important that because I will say previous generation because since 1985 I'm into this field, and last 28 years I'm a teacher, and I've seen generation of postgraduates, and the change in the entire whatever profile of the postgraduate students which we are witnessing. So some of my comments may be little harsh, but they are truth. So, and to witness that, like first and foremost, is postgraduate students have adult learners. It is not, they are not bachas. They have accepted this profession because they were aware that what they are going to face. That is the first thing. So adult learning principles are applicable. They know which institute they are selecting, and when they select the institute, they know that whatever is heavy. Now my residency was in LTMC Sion Hospital. My professional colleague during that course is sitting there, Dr. Arundhati Karanpur, and her husband also is there in the audience. Now the kind of that word slogging was used by Ashwini. It is actually the experience. It is not slogging. The more you get patients, more you are exposed to, and that's why the postgraduate students coming from government hospital can get adjusted anywhere. So what is important is the aspect which there are multiple aspects. I will not repeat what my younger colleagues have said here. The time management, the work-life balance aspect of it. And the most important is that it is not that suicides are more in doctors. Definitely not. If you compare the general population, the suicides in doctors actually and the mental illnesses, what is happening, is a social taboo. Or we doctors don't accept that we have a like maybe a physical illness like that. We also may have a psychiatric illness, and they are inherent. Many times the psychiatric illness cannot be avoided. So if there is a depression, to go to a psychiatrist and get yourself counseled, psychologist, Madam is Mamta is sitting there. So how many of us by ourselves go? I just end this comment by a short, my own experience. In the COVID times, most of you know that I was leading KM COVID. And at one particular time, after say 140 days of ICU, working in ICU of COVID and counting those dead bodies, I had a severe like stress. What I did, I contacted my colleague of other hospitals from psychiatry department, and she gave me a simple solution of venting out in the social media. That day onwards, I wrote so much in social media, my Facebook pages, and those Facebook pages have become inspirations for other generation. So that is where we should accept that we are human beings and we also can have psychiatric illnesses and depression and stress. I think I'll stop here and let's go to the further discussion.
Yes. So three different perspectives, totally, absolutely amazing, sir. There are, I mean, all of these points generally are very pertinent to today's generation. So I'll quickly go
Before
to
Tarang,
yeah.
sir, I think that is the one thing even most of us should learn is how to use a social media, because social media is a very sensitive issue, and that also is very important for the mental health balance. And as you rightly said, that when we are looking at the medical deaths or the suicidal deaths, it's a majorly a work-life balance where the students are not able to maintain it, and that is the biggest challenge, because that is again gave the record of 33% students have commented in one survey that the major problem was the work-life balance. And the things which probably just one few more things which I will like to add here is, other than that, was there was some things where the fear of failure and making the serious mistakes were also the concern of the residents which were there as a part of it, and developing the clinical skills for the required specialty and the financial and the personal debt, because the students who are coming from the little low socioeconomic status and then they come managing with it was the major issue when it was the residents. Yeah, please go ahead, sir.
Great, great. So quickly we go to Dr. Mamta Shetty. Let me get Dr. Mamta Shetty in. So let us talk about the coping mechanisms. So what are the common coping mechanisms that residents may use, and what actually forms the basis of these coping mechanisms?
I think I'll answer probably the second question first. And when I'm answering, I'm aware that I'm going to ruffle some feathers. I think what is important to understand is that we come from a very patriarchal system. And I think most of us look at difficulties as something that we should be able to cope with, especially I think doctors coming from the kind of high functioning that they're coming from. I think everybody just expects them to jugaad, if I could use Dr. Vittu's word, and manage themselves and not complain and not talk about, issues. So I think the system, if it is patriarchal and if that system is going to lead to depression in me, then I think there are two answers to that. I need to look at the system and I need to look at the individual. Of course, people can talk about that, everybody is going through that system and people don't break down. Yeah, but that's not reason to say that the system is fair.
True.
But systems take time to change. Systems may not change. Systems are difficult. It's not only India that we have residents having issues. We have residents from abroad also who have issues. So to answer, I think the patriarchy in the system which says that, if we have suffered, you also, meaning if we have suffered and we have not looked at it as suffering and we can cope with it, then you should be able to cope with it. I think that's the system which says that humne kiya, aap bhi kar lo. And the current generation is not brought up with that kind of resilience, if I could say. We didn't have a choice, so probably we kept our thoughts aside, our feelings aside, and managed. But I'm not sure the current generation is brought up like that, so I'm not really sure if that's the answer to the question. But yeah, I agree with Dr. Salagde when he says that perspective is important. Yes, perspective is important, but it takes time to build. It doesn't come inherently to any of us. And that I think is extremely important. What I've seen as coping, to be honest, I've not seen a lot, because I think all of us know that residents don't go to psychiatrists unless there's a psychotic breakdown. I don't think residents ever go to psychologists, or I don't know about psychiatrists. Yet medicines are still okay, but coming for counseling is frankly not okay. So my data comes from very few people that I have seen, and mostly from reading, but it doesn't come from pure experience. I just want to clarify that. But what I have seen that people use is they use spiritualism, they use prayers, they use talking with their friends, they use social media for their benefit. There is alcoholism, there is taking medications, there is substance use. So there are these unhealthy parts of it also, which is there. There is eating, there is binge eating, there's binge watching. So there are these things which are there also. But I've seen a lot of people also try and mix it with prayers, with spirituality, with friends, with social contacts, talking with seniors, taking help now because we have social media. I think Facebook groups are there. So people do that. The only thing is the timings that they can use these frequently gets lesser as the work gets more, especially I think for JR1s. There is a different challenges. For JR2s, there's different challenges. So yes, but I would say that I think the system will also have to take responsibility. It cannot be individuals who are always held responsible for what is happening. I understand systems are not going to be easy to change, but I would say systems are also responsible, and we are part of those systems. So the responsibility we'll have to take up on our head also by saying that we are the ones who are saying that, if this I can bear, you can bear, four people can bear, then you should be able to bear. Yeah. So I think systems, including us, should take responsibility for that.
Very, very powerful message. So the powerful message again is, if you are going through something like this, you should talk about it. Talk about it to your seniors, talk about it to your colleagues, talk about it to some. When you get things out, suddenly the problems generally start to seem manageable. So in interest of time, I'll go to the next question. This is for Dr. Salagre, sir. Sir, how does this residency related mental health issues impact future professional life? Like, does it, or if it does, how does it do?
Yeah. So if we talk about this aspect, the impact, the most important thing is the dropout rate. Now, distinctly we have observed in our institute. I can only quote my institute that there's something called as a pre-COVID era and post-COVID era. So suddenly we have found that in MBBS admissions, because our number of admissions per year also have increased over the year last 2019 onwards. So the number of dropouts which are happening because of non-coping mechanisms or that anxiety or stress of being getting admitted to a profession where they were not mentally prepared. Maybe that parents had forced them. So the dropout has slightly increased. I do not have an exact statistical analysis, but definitely compared to previous years, the dropout has increased. Now, this definitely, this is a mechanical answer I don't want to give because there is a emotional quotient behind this that we are losing the seats. So the no the brain drain is, and we have want so many doctors, but unfortunately the doctors are dropping out in between. That is one aspect of it. But looking at to the other aspect, like as one of the PG was saying about just now, either Bittu or Ashwini, that difference between the preclinical, paraclinical postgraduate course and clinical and super specialty postgraduate course. When it comes to such a stressed out or anxious or maybe having a depression or stress related issues, resident is posted is in medicine, surgery, or anesthesia. Our Indrani madam is also sitting there. Hemant Kumar madam is sitting there. So what is important is if these department residents, if they are under stress, they can have the issues related to medical errors or maybe not having that ability to perform effectively, and that can have a direct impact on the patient care. So that is a dangerous thing when their whatever personal health impacts the patient care, then that there the issue occurs, and then giving the memos or taking them to the or making them understand or taking them to the psychiatrist or for that matter psychologist, all these issues arise. So if usually the MBBS course goes smoothly, and the first year residency, as Mamta has rightly pointed out, the first year residency, and we have seen, like the first year residents during the foundation course, we have picked up residents with the issues which are there because we conduct regularly foundation course for postgraduates. There itself, these with the red flag signs, we can really pick up who are those people. But that is a loss to that person's professional years. He's losing somewhere, and that then also the family must be getting impact because if the person is from middle class or a financially poor class and the entire family is dependent on him as a maybe a clinician or a subsequent specialty doctor, and he has this, and if you are not able or system is not able to provide a support or peers or the department is not able to provide the support, then definitely there is a loss to that particular family. So these are the impacts of that particular, including the patient related issues, which is a concern when I am talking to you as a physician or a physician. These are my points on this particular aspect.
So I think I mean I totally agree. But I think the residency is supposed to be. I mean, when the seniors and the registrars and the HODs, isn't residency supposed to be a point where you have a safety net? You're being in a professional course. You're coming to a professional course, and then the point of residency and the point of training is the ability or the freedom to make mistakes. When you take that away from an individual, I think that is what would be building up on more pressure and leading to residency related mental health issues. So
No, it is the competence, I would say. Like if they are being selected with that particular ranking to a particular institution, then they are expected to have that particular level of competence. And if that competence is there, they to become a professional, they definitely need to put extra efforts. Definitely, the amount of hours they would be getting to sleep or taking self care, depending upon the branches which they select. And that happens, I think, nationally and internationally to everyone. That once you are in a postgraduate course, undergraduate course is smooth sailing many times. But postgraduate courses, definitely, and that's what the agenda of today's meeting is there, the coping mechanism for the stress which is there related to that profession. Because, see, for example, in a super specialty department of, say, oncology, there are so much of stress related to breaking bad news that if that person is emotional, or that for a simple like medicine or surgery, when there is a continuously there is some on a particular emergency that the deaths are occurring, and the resident is supposed to break those bad news, then that emotional stress, the coping mechanism for the resident has to be there. That's why the resident has to be taught in a workshop how to break bad news, or how to have the difficult communication which our institution does. And it's where 275 workshops across the country I could do because people invited me for this class. So that is where the awareness is started. That we need to trigger, we need to give support to our residents because
yes.
they do not have this ready-made knowledge of special skills. That is my point. Thank you.
Yes, yes, absolutely, sir. Totally agree. So, regarding acceptance and all, so I'll go to Dr. Shetty once more. So, Dr. Shetty, and I really want Bittu also to come into this. So, there are many teachers and mentors also listening. So, are there any specific indicators that PG teachers or mentors generally should be vigilant? Or for Bittu, that you should be vigilant at what is your co-residents going through to offer support to the students with residency related issues. So, Dr. Shetty, starting with you, and Bittu with a quick comment.
Yeah, I think compartmentalization is one huge coping mechanism that most doctors use. And I feel that compartmentalization probably works best. It's not that it's a bad coping mechanism, but I realize that compartmentalization just becomes compartmentalization without, going back and looking at what is happening to me. So I think that is there. But I think I would like Bittu to answer this first, and then I will.
Okay.
Yeah.
Okay, ma'am. So, sir, what I feel is that if my co is suddenly, there are changes in their behavior, like they are starting to stay irritable, they are not talking as much like they used to do before, they are not really coming out. So, when you have a plan with your gang and you just want to go, and they are repeatedly saying no to plans. And then for the teachers per se, I would say that, they are missing deadlines. They have started to make some errors, some very common, very simple mistakes which they would have not initially, but now they are. Somehow they are not very focused, and you can make those things out. Their body posturing, the way they are, you have those aloof vibes, and you can see that there is something definitely wrong with them. They look super stressed out. They are no longer keeping up their appearances, and they are skipping meals, and maybe they have those dark circles because they are not able to sleep properly. So all of these things maybe should be an indicator that yes, there's definitely something wrong with them. And maybe from there, then we try to ask them that what's wrong, what's bothering them. Just invite them over for a cup of coffee, just drag them to the cafe maybe, and over a cup of coffee try to know that what's bothering them, what's going on.
Yeah, to add, I think to that is a self-care, I think becomes like it really deteriorates. And I think errors start coming in, and doctors overall, I think, have a high need for perfection and want to be correct and right in whatever they do. Uh, I think connected to the profession and connected to the fact that they're dealing with patients' lives. So I realized that when it goes, like even if let's say there is a death that's happened, generally, I don't think anybody supports residents when patient deaths are happening, except maybe seniors who are there around. So I realized that a lot of them go through a lot of feelings after that. And because I think breaking the bad news, making the death certificate, putting all your notes in, keeping it's really, really stressful. And therefore, I think self-care starts to slip first. And I think self-care, when in highly functioning individuals start to slip, I think it's a big warning sign that something is really going wrong. Because I think when you're looking at high functioning and you realize that the basic routine is not done by this person, like I think bathing, taking care of yourself, you can make out, like I think Dr. Bittu says, a lot of these things need to be taken into consideration. And I feel that seniors and the teachers, both belonging to the same profession and are sharp observers. So I think a lot of, I've realized seniors and teachers pick up, in fact, students who have residents who have issues. But I think maybe around deaths, maybe around facts that there are a lot of admissions in the ward, all of these are probably warning signs that the people who are otherwise coping well may be finding it difficult. And I would also probably be pointing out, nobody looks at them, but even the high copers, I think are the guys who should also be looked at, because at some point it can become that, I'm coping so highly using all my resources. At some time the break can happen and I can really plummet down. So I would look at both.
Yeah.
I think that's very interesting comment by Shetty madam.
Yeah.
That
I
both
have a
should be
quick
taken
comment
care
on
of.
this. I have a quick comment. That's why I raised the hand.
Yes, sir.
I do not want to repeat what is being said, but like a couple of weeks back, maybe a month back, our own postgraduate student committed a suicide. Right? It was a shocking thing because first time in the Department of Medicine this thing happened, and this particular boy was in touch with the same night. He was in touch with the registrar. He had a meal with the registrar at 1 o'clock in the night, and in the morning, unfortunately, we get a dead body of that particular boy. His own brother was in the same institution doing an internship. Now, what is important is that he was not mixing with anybody. He was having repeated absenteeism or sickness, and did not have any social media account. Now, these triggered in the December month that one of the HOU diagnosed this, and he was referred to psychiatrist for depression and stress-related issues. So, see this: the red flag signs may not be there, but the subtle signs like repeated absenteeism from the job task of a medicine resident. So this triggered the head of the unit of that particular district posting to take a psychiatric reference, and he was diagnosed and he was on treatment. Unfortunately, this incident occurred in spite of being on treatment. But what is important message is always the red flag signs may not be there, but as a mentor or as a local guardian or as a teacher, is our responsibility. Like, one of the last year only, one of in the foundation course, we diagnosed that one of our student was aloof. He was not taking part in the discussion. He was away. He was, giving eccentric answers. So he was the one who was like Bitu said that he was told, other students were told, take care of him. There is something wrong. We will observe him. And subsequently, parents were called and counseling was done. So these are the things which are of concern as a teacher to me. Thank you so much.
Great. So I think we that is a very important point that needs to be taken into control. But since there are so many teachers who are also listening, there are signs which have to be picked up. Even if we can help one student go through whatever he is going, I think that would be a success of this session. So let us go to Dr. Mamta and Dr. Ashwini now. So Dr. Mamta, how effective are psychological assessments, and should they be a part of routine pre-employment screening? So we'll have Dr. Shetty speak about it and a quick comment from Dr. Ashwini.
I'm really scared of this question. See, I think I think one thing has to be very clear. The psychological test can be used as a screening device, but many of the psychological tests or the clinical, the personality tests that we conduct on a clinical population after we have like a diagnosis and a good history. I would say I would say that you have to be very, very careful as far as this is concerned, because once you set a precedent, then everybody just wants to follow it. So I'll be very careful. I don't think my personal opinion is a psychological screening may be done, but uh, I'll have to be very careful, because as I think you get, rather than that, I think when you move from MBBS to MD or a postgraduate degree, having a bridge course in terms of, the stress management techniques, having workshops, helping people manage will probably work more than a psychological test per se. If you have a robust system, the robust system picks up people who have difficulties and you can address that. But I'm not very convinced because I think a lot of people are scared of their licensure if they have a psychiatric history. So I know that a lot of them do take medications in their own way in terms of going and approaching psychiatrists and they take medications, but I don't know if it comes on paper in terms of a psychological test, then I think people are a little scared because stigma is huge. Our country is not something, I mean, we're not very nice, I think, as far as mental health issues and doctors are concerned, because the minute you get this feel that the doctor can't manage, then you feel that, oh, then, this person can't do any good work, which is not true, frankly. The other thing that I just want to add is that instead of a psychological evaluation, or screening may be done, but one will have to be very careful what kind of screening. Instead of that, maybe something that we follow in our field, mandatory therapy when they are studying, if that facility is given to them in terms of you can approach this person and you can talk, and if confidentiality is completely ensured, then I think that works much better than saying, oh, let's screen this person और उसको पता चलेगा कि मतलब next 3 years of master's program and nothing will happen to this individual. I don't think we have any test which can help us to do that. Yes, it can help us to pick up certain things, but rather than that, I would feel that the other ways of managing should be more could be more efficient.
Okay. Ashwini, a quick comment. Is that the answer?
I feel madam is right, because even I feel that something like what pre
Employment.
pre-employment psychological testing. I mean, the results are very subjective, and people don't really give probably the right opinions. And secondly, it is like, as sir said, it is already like we have been through MBBS and we have been through internship. So if the professional per se, we have been through all the fields, how all the other fields work. So there is nothing new for the person to go into a particular field for residency to get adjusted there. So I feel such testing won't help much, and that won't decide what will happen in 3 years. Ultimately, that person is supposed to live with that field for rest of the life, so he is supposed to manage that. So
Salagre sir, a quick comment on this.
Yeah. See, when this question came after the unfortunate death of our PG, that there was a thought process that whether all the postgraduate students which are coming this year should be subjected. I said nothing doing. It's the autonomy of that person because he's an adult. If he feels that he needs to go to psychiatrist or a psychologist, he should go. We cannot force that everybody has to go and get it certified. What is the chance that those who are certified that do not have stress will develop stress afterwards? So it is not, that is not the solution. As Mamta has also certainly suggested that we can suggest that, okay, that this is the likely possibility. But what is important is the environment of the department or the unit needs to be in the sense that are we giving them training as they join? Is there a facility where there is a foundation course? I just gave a quickly my exam in our institute what we do in my department, and several other departments have started doing it, including Indrani Kumar Madam calls us for communication skill workshop for their PGs. Surgery department, other department have started. Foundation course has topics such as time management, work-life balance, and coping with stress. Who takes that topic? Our HOD of psychiatry, Dr. Ajita Nayak Madam takes that. So as we are preparing them for these 3 years of journey, in the beginning itself, if we can provide them the resources, and unfortunately, in spite of that, one of the PG student has done suicide. So what is the guarantee that was 100% agree to Ashwin that we should not force them to undergo. Rather, it will form a taboo. Like people will get scared to join medical profession if we start implementing. But something other than that quickly is about the mentorship. Our Dean Madam has started, respected Dean Madam has started student dosti program, where there is a proper faculty and mentor-mentee relationship which is getting built up. That is the solution. So that is what I want to say. I will cut short because we are having short of time. Please have a next question.
Yes. Dr. Sapnali, you were saying something. I'm sorry I cut you off
Yeah,
and I ended off.
yeah. I was just thinking, just the Salagre sir commented the same thing. I was just about to say about the formal and informal mentorship, which is very important. So, formal mentorship with the teachers or your faculties is important, but along with that, there is a peer mentorship, which is also equally important. Because,
Absolutely.
as Dr. Bittu said, that it is so important that there are certain things which a resident or any student, undergraduate or a postgraduate, any of the student, they will not be able to share all those things which they want to share it before with the same age. So it's very important to have the formal mentorship which can be implemented, but at the same time, informal and conducive, comfortable environment for the students is very important.
Great. We'll go to Dr. Salage sir again. I know he has to leave exactly at 10. So, Salage sir, how do we promote communication amongst the students? Should all of these issues start from the foundation should be built from the MBBS, how to cope up with stress, and how do we get students to open up to their colleagues or to their mentors, as you said in the Dosti program?
I will answer this by putting a syndrome. There is a Sir Madam syndrome. What is that Sir Madam syndrome? The first year postgraduate students address the second year postgraduate student as Sir and Madam. We need to stop this syndrome. What is this 1 year difference, 1 year age difference, and they start their immediate seniors to call sir and madam. In our department, our HOD and we all have requested, directed, but what something has gone in the brains of the student that the immediate next seniors are called as sir and madam. I remember my science days, Arundhati is sitting there, and all the faculty members are there. We never used to call our registrars and this thing as sir and madam. So that is where the interprofessional relationship, that is very important. Coming to the level of the students, and definitely, as I do not want to repeat, but something to give them as a package for 8 to 10 days or 7 to 10 days of foundation course, making them sit, making them aware what is there in the 3 years. It is like, it is like a menu card. That in that particular foundation course becomes a menu card for them, that what is there in their thali for the next 3 years to come. So these are the aspects which are important. What I will also talk about is, we need to add a platform to express, like SRs on the contractual basis, like junior cadre. They are having that age bar is not there. So they can build up a rapport. They can have dialogue with the students. So that is one suggestion which we are started implementing, that giving that mentorship to the junior people so that that age difference is not there. How will they will talk to Solange sir? Instead of that, they can talk to my SR. So this kind of a relationship build up without hierarchical issues also can be one of the things. What is most important is effective communication. I think that is very important, not only with the patients, but with the colleagues, with seniors, juniors, with the team members. If we start that, and that is how our passion is there, and we all are working. Indrani madam was working for the same cause. Swapnali is working for the same cause of building up communication skill. I think that is what is important. Susamvad. The Susamvad is lacking because of the nuclear family. People are not getting exposed to that. We all are from the I got 5 siblings, but that doesn't happen to everybody nowadays. It's just a single child, and there the problem issues start coming, and that is why I think we need to have an environment which is to be built up for the betterment of our residents at all the angles. Thank you so much. Yeah. I will be there for a couple of minutes more, so you please continue. If any
Sure.
further comments or question is there, but let others also add to this part aspect.
Thank you. Thank
Taranga, I will just intervene here. Dr. Indrani ma'am is here. So let's hear from her also, her experience and shares.
Yeah, thank you so much for getting me in. As Dr. Santosh Salagre sir said, that, whenever we have a new crop of residents coming into the department, so see, they have to know the set of rules in the department. They have to have at least certain basic skills. Many of them are coming from private medical colleges. Some of them are high on the rank. Some of them are low on the rank. But at the end of the day, you need a certain set of skills which are basic. Okay. And of course, their backgrounds, their parents, their teachers, every background, everything for every student, it is different. And in KEM, we get a lot of people coming from different states. So when they just suddenly reach in to KEM hospital, in a small, all, 4 or 5 of them in one room. And then, they come to the hospital, suddenly they start emergencies and they start something new, which they don't know. I mean, the anguish, and, they come with a lot of psychological baggage. There is no two things about it. So I think as head of the department and as teachers and mentors, it is really our duty to ease them out in the entry level itself. So, and that's how we used to have Dr. Salagre come in, do the communication skill for them even before they start anything in our department. Communication skill, CPCR, these are all basic things within the first week of residency. So that was instilled to them. And as far as from my experience of what I've seen about residents, what I feel is the problem could be two types. One is person related, which is interpersonal relationship. Okay, so you may have a problem because the hierarchy, as sir said, you have that sir and madam syndrome. So there is a huge hierarchy, and the second years don't want to be disturbed. They want the first years to do everything, and the one-upmanship, big brother attitude. All these are problems which residents are facing. They will not tell you. So when you have this mentorship program, as our dean has started, I had started in my department. I said each and every teacher should take their ward out, sit for a cup of coffee and discuss personal stuff. Even personal stuff. So you stand like a rock behind your ward. And if there is any problem, you come to me. So, and I would tell them, you all can come to me directly. So in fact, I have saved 2-3 marriages also in all this. So what has happened is, that is one is interpersonal problem. The other problem which I see is a system generated problem. See, ours, we are doing, it's an inhuman way of working hours. Okay. And in your rounds, you find that this particular thing is not done, they get bashed for that. And God forbid, they have worked through the night and they have not even had breakfast. They are with you over here. They are doing, blood collections. They are doing everything. And one particular thing is not there and they'll be bashed like anything. I mean, so that's the system. We are talking of a system which is like that. Okay. So maybe, in fact, my daughter was telling me, she studied from Mount Sinai, New York. She did her residency there. She was saying, Mama, you have the power now. You can change the system in your department. But by the time I could do anything at all, COVID cropped in and the students were even more stressed at this point of time. So what I feel is you have to give them a little bit of rest. You have to change the system. So for the mental well-being, physical well-being is also equally important. So I feel, it is not just one problem. It has to be tackled from all sides. Only then the residents, can have a residency which they can feel proud of, and learn the maximum through their residency. That's my opinion.
Thank you so much, ma'am. That has been really enlightening. We absolutely have the privilege of having you in the discussion. So, Dr. Shetty, I would really like to listen to what you have to say about these two comments.
I think it's such an important point that Dr. Indrani is talking about, because I think when we are bringing psychiatry and psychology, see, more people are going to require psychiatry and psychology. I think the system is really slipping. I don't think people should require us so much. I'm sorry if we are losing jobs, but what I'm trying and saying is we shouldn't be requiring so much of psychiatry and psychology. And if we are now saying that we want tests and we want every individual person to go through screening, I think it's unfair. Yeah, it means that you create systems which are so patriarchal. You create systems which want it to be followed by hierarchy and by order, and then you say, oh, you can't deal with this system, let's medicate you. and let's send you to a counselor. I think that's extremely unfair. It's extremely unfair on bright minds anywhere. It's not like only in the field of medicine. So I would definitely agree with her and say if the system, I know that as I said in the beginning, systems take time to change. Yeah. And we can't like really wait on systems to change. But in the meantime, if you're going to, put people under the altar saying that, okay, let's, just put you up there and put you up for sacrifice, I don't think it's fair. So definitely, I think the systems need to change. And if we are going to keep saying we could cope, you should cope, I think it's the most worst things. Even when Dr. Indrani says, I was thinking about her, even when she says, come to me, we are all saying, okay, let one or two people will take the entire system on their shoulders and say, come to me. After some point, she's not going to be able to give that support, right? Even if she wants to do it from her heart, because she'll also have to self-care, do self-care for herself. Yeah? So I would definitely say that the systems need to create bridge courses, foundation courses, all of this, which not only address the doctor's frontal lobe, because I think that anyway is functioning all the time supremely, but also looks at the amygdala. The heart needs to talk to the head and the head needs to talk to the heart. You can't say I'll compartmentalize and I'll not have these two guys talking to each other. And if we are functioning from our head, we function beautifully. And our entire generation has functioned that way. We have not really looked at our emotions and we have not really looked at things. We are just saying, oh, let's cope, and it works best for everybody, because then we become more and more better in our coping and everybody starts looking up at us, and that position maybe that feels godlike. So I feel the amygdala and the frontal lobes anyways are very good. By the time you pass MBBS, I think your frontal lobes are functioning at a pretty good place. I think there has to be some way in which the emotions need to be addressed. So what I've heard from residents, or let's say what I've heard from the doctor population, I think the time when I see them coming generally is when their children have issues. Otherwise, I don't think I've ever had medical professionals come for help in that sense, very, very, very willingly. Yeah, unless their marriages are at stake or there's some problem with the children, they don't come in. But what I would like to say is that in the compartmentalization that they are doing, which is not a bad coping technique, but what needs to be understood is, and I think a lot of doctors will say this. Also, what we can go to the counselor. What will she say? We'll go to the psychologist. What will she say? But the point is not what will she say. The point is you talk about what is happening to you. Talking does not mean that the psychologist will give you a solution. Psychologist is in no position to give you any solution. You are in the system. You have to do the 24 hours, 48 hours call. You have not got a post recovery sleep. I am no one to tell you, oh, do it like this, do it like that. You'll probably want to not come back to me again. Yeah. But the fact that you speak about what is happening to you, I think and the fact that somebody is listening to you is a huge relief. Yeah. Solutions are not answers to everything. The fact that you can share itself is a huge thing. Having a perspective. Yeah. Seniors giving a perspective that things don't look like this all the time. And I keep saying a lot of doctors have this demand on themselves of perfection. They want to do it right all the time. Yeah. Like it has to be right. But being good probably is more important than being right all the time.
Well said. Well said.
And I think this is such an important thing for doctors. And nobody talks about this. Everybody seems to be like they're coping the best. And I've heard so many doctors speak about this. If they are doing it, and if I'm not doing it, then I'm less of a person. Therefore, I should be able to do it. Yeah. So therefore, I think we can't catch this. Even if we have started programs, doesn't mean we are not going to lose people. But I think it's a shame that we are losing people, and we are saying it's their issue. Yes, as Dr. Indrani says, some of it is interpersonal, but that happens in every area. Yeah, but I feel your systems are pretty inhuman, and the systems, whatever individuals can create that system to be a little better, that will help. But of course, having perspective, uh, not taking others' frustrations personally. I think I don't know if building a wall helps, but something of that sort. Meditation really, really helps. I know that a lot of doctors do practice it, and it does make a huge difference to people. Though it sounds like I'm talking one of the yoga techniques, but I realize that helps. Exercise helps. Any kind of exercise helps. And talking. essentially talking with people. I would also probably say this, I say this to psychologists all the time, that don't have only psychologists around you. I would say that to doctors also probably, that you need to have conversations with other people and with other, of course you will probably be the best understood by people from your profession, but you need to have outside people from outside professions also, and just keep talking. Talking does not mean that there'll be solutions, but talking definitely means that you're heard, you're listened to, and you can and somebody can probably tell you certain things also which may not make any difference to you, but at least you're talking. So I think sharing would be something. And mental health care facilities, in whatever way you all can do it, like addressing this, having, and as I said, either it can be made mandatory or it can be given as free. Like, don't have to pay for it, but go for these weekly sessions or go for these monthly sessions, whatever can help, that can really help. Because I think the head is functioning beautifully. I don't think anybody has to really address the head. It's the emotions or it's the amygdala that I would probably be paying more attention to as a psychologist.
And
Thank you.
also, what I feel is, instead of reprimanding them every now and then, trying to give them, tell them, you've done it so well, awesome, and try to motivate them, and give them, a good thing about what they have done. Small things will make it comes a long way, instead of all the time scolding, reprimanding them. Even if they have done something small, you give them that praise. I feel even that will help.
Thank you so
And
much for all
and
those
again,
powerful.
if you lead by example, Dr. Salagre did it during COVID. He didn't sit back at home. He was there in the Maidan all the time. So then what happens when you see your senior himself doing over there? The junior will not say, now I will get COVID and I'm going to die. The junior will say, no, even my senior is working over there. So I will also have to do it. That automatically, that strength, mental strength comes. Otherwise, I think during COVID, the residents had, maximum mental issues. So, again, leading by example is again another very good thing.
Yes, absolutely. I mean, COVID was a very tough time. In fact,
Yeah,
we
yeah.
actually had done. I and Dr. Alpa Dalal from Jupiter. We had actually done a study which talked about mental health and sleep health during COVID, and we almost found that close to 45 to 50% of doctors, especially residents, had a very bad sleep health and a mental health. So thank you so much for all those powerful messages, Dr. Mamta. I should get that written on my wall in the OPD. I mean, all the stuff that you said. So that almost brings us to the end. So quick comments of everyone, starting from Dr. Swapnali.
Yeah. So I think the session and interaction was wonderful. But the one more thing which Madam Indrani Madam has said, similar to that, I just remembered one of my teacher during my residency used to tell me early morning. The first question used to be, "Did you have your breakfast?" And that is so caring that automatically, or if not so, then he used to see that after the round he takes us, means being a resident, he used to take us to the canteen to eat or give at least 10 minutes to eat. It is not the question of eating, but it is the caring nature of the serve which mattered a lot. And I think that is the one thing which, as Indrani Madam said, that when your seniors are there and they are looking at your very caringly, then it automatically gets imbibed on the students that, okay, the person is working, I should work, but then I have someone to support me at all the time. And no question that rewards, as Madam said, is very important. So I think with the formal mentorship and giving a support and making a more environment better and better, that is the key for whole of a thing. And मेरे लिए कोई तो है, when the person is, I feel that there is a huge difference between a loneliness and a solitude. If the person is lonely, he should know that there are so many other lonely and I have to be there as a part of them. And he should have someone where he or she can be able to speak. And solitude is fantastic by meditation and exercise and so many other ways of the gratitude and a reflection. So those are the one which will make the person peaceful, and I think that is the one which is very important.
Okay.
Thanks.
Dr. Ashwini, quick take-home message for your co-residents or for your juniors.
Actually, it was a very wonderful session, and it is like, I mean, yes, I mean, you are supposed to cope up. Sorry, and do it like properly.
Yeah.
I
Dr.
mean, I
Bittu.
don't know what else to say. I mean, it is like you need to cope up
Yes.
ultimately.
Okay, Dr. Bittu, message for your
Yeah,
co-residents or
so
for your juniors.
what I would say is for this challenging phase of your life, ensure that you have a strong support system in place and have a hobby that has no connection to your profession. A complete different hobby which helps you refresh yourself, rejuvenate yourself. And don't hesitate if you need to ask for a break. Sometimes, I don't know why, but we feel guilty when we are asking for leave, as if we are doing something wrong. So, please don't hesitate to ask for a leave when you feel like you really need a break.
Or
Where
watch
that
a
is,
comedy.
Yeah.
Bittu, that is very well said. Salagre sir, final remarks.
Yeah. So I'll just put it in 4 words. I just was summarizing it. First is care. The care includes self-care and care of others. C for communication. Communication to self in a form of reflection and communicating to others. The next C is compassion. Compassion for whatever you have chosen as a professional journey. And the last C, I'm actually taking it from Ashwini, and that is coping. If you are not able to cope, try to have the whatever possible resources within the institution, including our psychologists sitting there, so that as an adult learner, you have these coping mechanisms. I think these 4 C's I will conclude here. Thank you.
Great, great. Indrani ma'am, last few words, please.
Dr. Salagre said everything. Yeah, that is, you have all the 4 C's are very, very important. You know,
Yeah. Dr. Shetty.
Emotions are huge powerhouses. Don't ignore them as far as possible. But Dr. Tarang, what I would like to say is this is a small noise that you have tried to make with this program. I think it needs to reach larger number of people, and I think the effort should be consistent and continuous, because I realize that we can talk like this and then switch off because we have so much of work left otherwise to do. But maybe to continue all of this probably will be a good thing to do.
Yes. Yeah, Ashwini. Yeah, go on, Ashwini.
About this emotions, I just realized one thing. It is like I feel that change of thoughts is very important, because when your mind is diseased, you like just move around the one thought, and then it is very difficult for you to come out of it. And then it is very difficult to stay, because that thought just eats up your mind. So change of thoughts, and so getting into the, I mean, engaging yourself into the work of residency is very important. And that change of thoughts will help you in all respects of your life. That is not the only thing, but that is to come out of all sorts of negativities that you follow, that you face in the residency, I feel.
Thank you so much for that. I'd like to thank everyone, all our esteemed panelists. This session was, I would say, strangely therapeutic to everyone, and especially I would like to thank Dr. Sapnali Kadam, absolutely instrumental in bringing all these things together. So, and in the end, I would just like to say, all these residents are the best minds in our country. They deserve much better than a Saas Bahu relationship in their workplace. So I think we have made in good strides in this particular scenario. As Salagre sir said, the mentorship program, I think that could generally be the answer, the missing link, what we really need to tackle this crisis. This absolutely has been amazing. A few years ago, we actually started, a debate was started all across regarding ragging. And today, we actually do talk about it. This has been talked about a lot in the media. I think it is time that we also take a look at it from the same perspective, although it's a very less talked about problem as compared to ragging. But who knows? Probably 10 years later, this would also be openly talked about. Thank you so much. This has been absolutely amazing. And I bring the meeting to close. Thank you.
Thank you so much. Thank you so much. All the
Thank
best.
you.
Thank you,
Thank you.
Taran.
Thank you. I would like to thank Swati to connect me over here. Thank you so much.
Yeah, thank
Thank
you,
you,
ma'am.
ma'am. Thank you for joining. Thank you so much. Excellent session. Very, very well.